This doctor was checking a patient's teeth. Even after checking well, he did not see anything wrong in his teeth. But the patient was telling him the same thing again and again, that he was in pain. The doctor could not understand because his teeth were absolutely fine. No cavity and no swelling, still don't know why he was in pain. The doctor also looked carefully at his x-ray. He saw some white shadows near the roots of the tooth, but he thought maybe it would be some reflection. So he told the patient, "Go rest, everything is fine." In the evening, when he was finishing his work, he saw some insects in the sink. When he took out the filter, he saw that the filter was completely filled with insects from inside. He was surprised to see this. He immediately threw the filter in the dustbin. But then he remembered something. He immediately went to his computer and started zooming in on that man's x-ray again. Now he understood that those white shadows were actually insects, worms that entered the roots of the tooth. He had never seen this before, so he went straight to the library to research. After flipping through books for a long time, he found information about it in an old book. Actually, these worms are toothworms. They lay eggs near the teeth and gradually spread inside the body, even reach the brain. These worms were created during an old bio-experiment, which was stopped a long time ago, and after that, these worms were never seen again. Now, after reading this, the doctor became very tense. At the same time, a call came from the hospital. The same patient had come back again, and this time his pain was even more severe. Now that he had come to know that there were worms inside the patient, he remained silent for a while, thinking. Then, from the other side of the glass, he told the nurse to wear gloves and goggles because this is a little serious case. But the nurse took his words lightly and asked him to come inside quickly. Now he had no option. He quickly wore a protective suit and prepared for surgery. As soon as he cut the patient's gums to remove worms, the patient started writhing like crazy because those worms had sensed the danger. That is why now those worms started moving rapidly towards the brain.